Welcome, everyone. Thank you so much for joining. This is the first webinar in what we're hoping is a series, and we've tried to highlight topics that we are seeing bubbling up from our nonprofit partners, owners, operators, and service providers of affordable housing. And I'm very, very delighted to be joined by three practitioners from across the country who themselves are responsible for managing third-party property managers during COVID-19. And I'll say up front, just to set expectations, that this, we really are focused on that relationship between a third-party manager and an owner. And we know there might be some of you out there who are yourselves self-managing your portfolio, and I'm sure there will be, good insights and takeaways for you. But our panelists and really the focus of this webinar is the management and the relationship and developing a healthy, productive relationship with a third-party manager when you're sort of one step removed from the residents that you're supporting and serving. Panelists, could I ask you actually to mute until we get to intros? Super. So that's just to set expectations. We received some terrific questions during registration. I've combed through those and incorporated several of them into our discussion. Of course, can't incorporate all of them, but appreciate you sharing those questions in advance because it definitely shaped this session. There will be an opportunity to provide us feedback in a survey that goes out tomorrow. Very quick 5-question survey, which also gives you the chance to tell us about other topics of this type that you would want to hear about. The last thing I'll say before we do intros and just kick into discussion is that this is really a discussion among peers. And one of the things we discussed together with the panelists is that, everyone's trying to figure this out. This is a complex topic even without COVID. So, adding in COVID, it's not like everyone, it's not like our panelists have, this perfectly figured out. And there'll be some topics where, we're just sharing the challenges and not necessarily have a silver bullet solution for it. So we just thought that, putting sort of on stage and spotlighting a discussion among peers on this topic would be the best help we can provide in the absence of some, play-by-play guidebook that we can deliver to you, which we would love to do, but it doesn't exist because everyone's navigating the best that they can. So that's what I'll say. And then also keep a lookout for some follow-up materials, sort of a summary of the discussion and any tools or tips that come up during this discussion that we think would be valuable to have in kind of a tangible takeaway that we'll share in the next week or so. The chat feature is disabled for this webinar, but the Q&A feature is active. And thanks to my colleague, Jenny Yang, who's going to be monitoring that, and we'll save about 15 minutes at the end of the presentation for Q&A, that's submitted through Zoom, as well as some questions that I know came in through the registration that that were also particularly good, or many people raised them, so I pulled them out. So so please feel free to submit questions, and then also feel free if you have tips or resources or things that you think could contribute to like a takeaway document or a tips document, please share those so that we can have a record of them and incorporate them into the takeaway that we put together in the next week. So with that, let me stop sharing so we can see our faces here. Here's our esteemed panel. And I'm going to introduce myself, and then I'll just turn it over to you three to introduce yourselves. So my name is Carrie Wagner. I'm a program director with Enterprise Community Partners, and I co-lead our enterprise, COVID response program that's including, technical assistance and webinars like this, content development to support partners who are, getting through COVID and all the challenges that are facing them. I'm joining you from my living room in Detroit, Michigan, and I'm going to be moderating the session with our panelists. So let me turn to Wanda first to tee you up, and if you could share, if you all three could share your name, your organization, the size of your portfolio, so folks get a sense of that, the location of your portfolio, and then if you could share something that you have learned about yourself in COVID world and in the COVID quarantine over the past 4.5 months. Could be silly, could be serious.
Well, thank you, Carrie. Good afternoon, everyone. I am Wanda Langley Hardy. I am with Enterprise Community Development, and we have about 111 properties of affordable market, some retail. We have over 12,000 units in DC, Maryland, Virginia, and Pennsylvania. And something I've learned in COVID quarantine is that I am a great, my garden is doing fantastic, and I've learned how to juggle a lot of elephants in this world.
Fantastic. Thank you, Wanda. Tayani?
Hi, everyone. I am Tayani Suma. I am with the Atlanta Neighborhood Development Partnership. We operate 3 main lines of business. In addition to affordable housing development, we have a small CDFI loan fund, and we have a division that focuses on community engagement and policy and advocacy. In our housing development department, we've got a number of single-family scattered site properties that we develop both for home ownership as well as for rental. Our multifamily portfolio is, as of right now, 5 properties operating 543 units, but we do have about 350 additional multifamily units, both bond deals and 9% tax credit deals in the pipeline, including 1 leasing and pre-leasing right now. Our target area is a broad Atlanta metro area target, so we're not neighborhood based and we're not just city based, but we are limited to our metro region. And something that I have learned during this COVID era is how much folks in our communities, in our complexes, in our homes love toilet paper and food. Because whenever we have had a chance to gift some of our properties, any of those items, there's been a wonderful turnout and a wonderful response and a whole lot of gratitude.
Fabulous. Joanne.
Okay, good morning, everyone. I'm Joanne Cohen. I'm Director of Asset Management for LA Family Housing. LA Family Housing has 21 residential properties in and around Los Angeles. We also own and we operate 6 interim housing sites of various sizes, also around the Los Angeles area. Our properties contain 405 units of housing. Something I've learned about myself is that I can cut my own bangs. Too many Zoom meetings and I get obsessed with my hair. So that's where I'm at the moment with.
Your bangs look great, Joanne. You have a true talent. Fantastic. All right. Well, let's get into it. I think, we want the bulk of this to really be hearing from you 3 as practitioners. So I'm going to kind of start by taking us back to the early days of COVID spreading, in your communities, and would love, for you to tell us about the early conversations that you had, the early steps that you took with your property manager about keeping, residents safe and staff safe. So what processes did you set up together? How did you communicate with your property manager? I'm going to start with you, Wanda, because I know that even before really conversations with your property manager, you were doing some particular analyses that turned out to be very helpful to you. So could you talk about, what you did and how and why it ended up being helpful to that response and your relationship with your property manager?
Absolutely, Carrie. We decided early on that we were going to be very proactive. And so we started out by doing a stress test analysis of our entire portfolio. And in doing that stress test analysis, we were able to then focus in on the properties that we thought were the most vulnerable during this time. And we stress test all the way down to maybe 50% of income coming into the properties. And so that was a start for us. And that gave each asset manager the ability to really focus in and hone in on which properties they wanted to tackle and to come up with a strategy. In doing that, once we developed that list, we instituted weekly, we reached out to our property management agents, and we manage about 7 property management agents. And we reached out to them with this focus list, and then started instituting weekly cash collection and accounts receivable spreadsheets that they had to send to us every week. And our data team, our wonderful data team, was able to then combine all that data and provide us with where we needed to look at and what we needed to start working on. We developed a spreadsheet to decide which properties could go for forbearances on the properties, which properties needed investor approvals for operating deficit draws. All of that data we gleaned before we got into serious conversations with the property management companies. Then we had very focused conversations. We stopped all capital work, all non-emergency work. Everything had to come through asset management in order to be approved to be done. And coming together with having that focused strategy really helped in the communications with our property management agents.
Great, thanks, Wanda. And as you can tell from Wanda's response, you know, she represents a practitioner who's now managing multiple property managers. So we've got a nice diversity on the panel here of, you know, just if you've just got a sole property manager or you have sort of a cohort that you're managing across a larger portfolio. Yeah.
Carrie, I'd like to also chime in real briefly. Please. At ANDP, with our much smaller portfolio, we do have a primary single family property manager and a primary multifamily property manager. Our core staff in real estate is only 5 people actually, and with 1.5 of us focused on asset management. And so we really started, our first effort was in having more frequent and direct intercommunication with our third party management. So we ratcheted up group calls to a minimum of once a week and usually 2 or 3 times a week, focusing more on quality of life issues initially and ways that we could make sure the properties were operating safely. Of course, doing what many people were doing all around that time, looking at closing down common areas and offices, extra sanitizing. How could we provide and do bridging of food and health needs, giving people some protocols for when they could reach out for us or should reach out for assistance. And during that time, we began publishing a resource guide for the, that was actually metro-wide that people, use on a regular basis that we publish now every 2 weeks.
That's great. And that gets into, previews maybe some future questions about really good communication strategies that you've seen work with residents during this time. So that's terrific. We had one question that's related to this that came in from a participant during registration, which was, what are the top criteria to be factored in when when we reprojecting a 6-month in the world of COVID, a 6-month projection for your portfolio or for your properties for COVID-19. So maybe Wanda, I don't know if that's appropriate to toss to you, given the projections that you all did at the beginning of COVID. What would you recommend are really those top criteria?
So there's sort of, there's some micro level and some macro level items. So I would think some of your more micro items would be projecting lower cash and economic occupancy, more bad debt, higher turnover costs, staffing, if staffing, family issues or COVID-related issues, having additional staffing costs. But then sort of on a macro level, you want to really talk to your mortgage companies about which properties are eligible for forbearances, which properties really can not do their reserve for replacement deposits during this time, if you have partners or that you have distributions, maybe, foregoing those distributions or saving that cash into a savings account and not distributing right now. So those are some of the top things that I would say to look at when you're doing your reprojections.
Great, thanks.
We actually divided our when I started working on our end on looking at things. Oops, excuse me, my dog just barked. We divided our portfolio between the buildings that were fully supported by subsidy and the properties that we have that are fully supported by only by tenant rent, because they were having, they're very different properties, and B, we were able to understand that a building that has subsidy was going to have less of an impact, financial impact ongoing, than a property that is relying on the marketplace and people's jobs in order to support it. So that was what we looked at. If you have a portfolio that has different types of projects, you may want to take a look at that and see how what the impact is based on what the source of revenue is.
That's great, Joanne. Thanks. And I think, one theme sort of already emerging is to really have a handle, I think, yourself as the owner on this, and not rely on all the number crunching to happen with the property manager. You really want to kind of be, directive and in the driver's seat in targeting the properties in the way that you want them to be targeted, and understanding those numbers yourself. So let's turn to health and safety. And we had a couple of questions come in and discuss last week amongst the panelists about the challenge of getting information regarding cases of COVID at your properties. So I'm curious to just dig into this. How do property managers know if there are COVID cases at the project? How do you know as owners if there are cases at the properties? And maybe Joanne, actually, I'll toss it back to you to kick us off, because when we were discussing last week, you did a good job, I think, of articulating really the challenge with this question. This is not a cut and dry question of being able to tell where the cases are and how many there are in the properties. So if you could just sort of talk about how you've been challenged with this, I think that would help others.
Okay. Again, our portfolio is divided between permanent supportive housing and just more traditional family low-income housing. In the PSH buildings, it's been less problematic because there's still services, there's still program staff on site. They tend to be able to get information from the residents more readily. The challenges at our family buildings is that really no one is under the requirement to tell us whether there's COVID in their family or whether anyone has been ill. Our managers don't necessarily, in some of our properties, we don't have key holders or managers living on site. So the buildings don't necessarily have somebody who's looking or, interacting with our tenants on a regular basis. And it really pointed out to us, we were already going to be doing a resident, a needs assessment for our family buildings. But one of the things that it really pointed out was how poor our lines of communication actually were with the people living in our buildings. We had no methodology for blasting any information out to anybody on a building or portfolio-wide basis. We didn't have a way for them to really respond back to us. I mean, there's telephone lines and emails and all of that, but it would seem to me that those particular items are very slow because they're one item at a time. And so part of what this has raised for us is that, in the end, we have to revisit what it is that we do as asset managers and owners of buildings in order to be able to better communicate. We live in Los Angeles, and we've spent a lot of years planning for earthquake preparedness and fires and floods. No one thought about a pandemic or a situation where we were all locked down and unable really, we didn't even think about this in a case of like of other types of physical emergencies. So what we've been beginning to do, and we'll be engaging the property management company in it fairly soon, is trying to figure out a text, like a texting service where we can communicate with all the residents. LA Family Housing has that for staff, where we're able to do a text blast through all of our staff. But now what we're going to try to do is institute that throughout our properties. Our buildings are very far flung physically, even though they're all in the LA area. And some are as many as 20 or 25 miles away from our main office in North Hollywood. So it also pointed out how we probably could do a better job of having some type of tenant service coordination or a coordinator, so that residents would have someone besides the property manager to communicate needs to, so that we could do a better job. This is a particular failing of our portfolio. I'm not saying necessarily that this is through everyone's, but we learned by getting shut down in March just how limited our communication was with our residents. And we've had a hard time learning who's been ill and who has not, frankly.
Yeah. Thanks, Joanne.
You're welcome.
I know that I think it was Wanda who talked about building actually a tracker, a COVID-19 case tracker, to kind of help manage this issue. So Wanda, can you tell us what that tracker looks like, how it's used, who uses it, how it's been helpful to you, if you'd recommend it to others?
Absolutely, and Joanne is absolutely correct. It's, that's the hardest part, is to make sure we know what's going on in our communities and get the communication in. So early on, the asset management team created a COVID tracker, and we sort of created two trackers. One was the actual COVID tracker, so we could track cases, and that tells us the management company that it's coming from, the community that it's coming from, the regional that is involved with giving us the information, and then sort of the history of the case, whether it's a resident, whether it's an employee of the community, and then we can track that out to the positive outcomes of the person is, now tested positive, they're back to work, or the resident is out of the hospital, or unfortunately, if a resident has passed on. But we developed that early on and sent the information that we needed out to all of our property management agents. And they were very good about getting that information back to us so that we could track that as a team, and the company-wide, we could know what was going on. And this tracker goes up to senior management so that senior management knows exactly what's going on at any given time, all of the data that we have. We also established the tracker for protocols to make sure we knew what type of sanitation and cleaning and what had happened after a case had been reported, so that we knew exactly what each property management agent was doing on site. And that was so we could compare which property management agents were doing what things, and if we could, spotlight something that was missing or something that needed to be added, then we could highlight that pretty quickly. And that's been very helpful, I think, to us and to senior management, but also for the communities, because we know that now what's going on in pretty much all of our communities, to the extent that it's being reported to us.
That's terrific. And let me ask a sort of an annoying, weedy, in the weeds question, but this came in from a participant, and I thought it was really good. If you have recommendations, actually this is to Wanda, but also if folks, participants have answers to this, you can submit it in the Q&A. If you have recommendations for platforms for sharing things like these trackers or the timelines, I mean, are we talking Excel? Are we talking, Google Drive? Just the practicality of, like, have you found a good system or product that you would recommend?
I think that's a challenge for everyone. We are using an Excel platform. We use Teams in-house, and Teams we are able to share data through Teams. quickly and effectively and get the data to who it needs to go to, especially our data team. So that we're still on an Excel platform for that. We have not gone to a more, we use SharePoint. So within the organization, anyone can have access that, we're granting access to for that data. It is sensitive data, so everyone shouldn't have access to it. But those that need access, we can do that through SharePoint.
And
Okay.
Carrie, for us, inter-office-wise, we use Slack, which is similar to Teams and some of the other systems, which has been helpful for us internally. But we found across companies in terms of sharing data about information that we'd like to track, similar, although we're not doing a COVID tracker because thankfully we've only had one case to date that we know of. We are using Smartsheet though for a lot of other individual unit, individual resident, individual property data sharing that can be entered into real time by multiple staff members and updated and, it's a web-based tool that is an Excel-like format. So that's been really helpful for us, particularly because, we can pin documents and electronic links to each individual line. So that's been critical for us.
That's great. And Tayani, I'm going to actually turn it right back to you because I would love to hear, starting with you, a sense, and you alluded to this earlier, but a participant asked, how often should we be checking in with our management companies to ensure that they're keeping up with the changing guidelines? So I think you gave us a little peek into this earlier, but could you kind of reiterate what, just from a cadence, perspective, like how often you're checking in with your property management company, I guess both the single family and multifamily?
Okay, sure. Pre-COVID, we generally had a standing monthly meeting to review operating financials and other site-related issues with resident well-being as well as physical plant type of concerns. But once COVID hit, we increased a standing meeting to a weekly meeting plus another couple of check-ins in between where we, as I said earlier, sort of talked about the health of our residents, what could we provide. The paper products, I sort of made the joke in the beginning, but we actually did do some initial supplementation of gifts of paper products to our residents, as well as food deliveries that are still going on. And so that is working well, sort of our weekly formal check-in with very much, in between on an as-needed basis. But what we've also done, and this has sort of pushed us into a little bit more of direct resident outreach on our part. So we're not, whereas before we were essentially relying and leaving direct resident contact to our management companies to handle, we've now layered in, we've got a former intern that we sort of transitioned. She's worked with us for a year and has gotten more familiar and more experienced with our portfolio and our style as a company, that she now actually has, with some technical support, has set up a hotline that goes out to all of our residents. And so they can reach out for information through the hotline in addition to being able to touch the property manager. And we also have layered in wellness check phone calls. So for particular units, especially at our senior properties and properties that we know we have, our single family where we have elderly residents, we've got her doing calls, or if somebody hasn't seen someone that they normally see, or if there's some word of mouth that someone may be going through some challenges or distress. We actually, in addition to just having the hotline sitting there, we will reach out to folks. And so that sort of layered approach of more checking in with the management company, plus sort of breaking through the wall of, okay, we don't touch residents directly, to doing some of that has been how we've navigated to this point.
Yeah, I mean, that's a big change, definitely, to sort of up that direct involvement. And I'm glad you brought up the hotline. I was actually going to inquire about that. So for those who don't have a 24-hour resident hotline who might be interested in setting one up, do you have tips for how that worked, or any just practical knowledge of like where you get started to do that, and if you'd recommend doing it?
Yeah, I definitely would recommend doing it. And I think probably there are sort of a multiplicity of options for setting one up. I know our staff just went directly to our local telephone company and created the functionality. So I'm not completely familiar with the ins and outs of how that took place. I do know it took place in less than 24 hours, so it was very straightforward and seamless for us. I do think that we've been surprised at the ebb and flow of calls that we get to the hotline. Sometimes there's a long period of time where nobody is utilizing it. Sometimes we get a lot of referrals directly from the management company. Folks need, residents need to get used to it being there as a resource and have a reminder. So a resource guide that we publish that I mentioned weekly always has the hotline on the cover and encourages people to access it. So it's been a good tool in addition with other means of communication that we've used.
Yeah. So I'd love to hear, Wanda or Joanne, if you have other recommendations for types of resident communication and engagement that you have found to be really effective during this time. We've talked about a hotline, we've talked about wellness checks, and the resource guide, and anything else that you might recommend or ideas you've seen implemented that work well.
Well, I will say that at Enterprise, we do have a community impact strategies department, and they've been really good about reaching out to the communities and doing the wellness checks. And we have now we're having weekly. It used to be, as Tiani says, we used to have monthly meetings, but we have weekly meetings now with CIS to let us know, what residents are in need, what's going on in the community, and then we can kind of incorporate that into our discussions and what's needed for the properties. So we've found that having that in-house community impact strategies department has been very beneficial during this time and very helpful to the residents.
And Carrie, I also see a question in the chat. If this is a good time to respond to what's in the resource guide.
Please.
So for us, the resource guides have been a big hit, and we were really surprised at that because they started out with us realizing we were getting so much information through emails, through the news media, hearing things on the radio and television about different things being offered to the community, from prepared foods that could be delivered to farmers markets that were being sort of pop-ups that were increasing, to educational supports for folks that were needing sort of online, as well as tips and recreational ideas for their youth that were sheltering at home. And so what we began to do, the birth of the resource guide, was gathering the things that we were hearing about from a multiplicity of different places and publishing them in a sort of easy to read format. And then in the beginning, always including here are the things that you can do if you suspect that you have COVID. Here are places for tests. Here are the recommended practices. And then general phone numbers that people could call for specific help. And so we found that the information we would get from these various places was very geographically based. So now we actually produce 4 versions based on, even with our small portfolio, based on where they're all located, and they get different versions. We subsequently, now more recently, have started an emergency rental relief program through help from a number of sources, but support from the United Way has been very, very critical in that and getting us started. And so the resource guide now publishes that information. How do you initiate an application if you have a COVID-related income loss to request some of these rental relief funds? So it's definitely evolved and changed, and we've tried to customize it over time.
And this might be something actually, if it's okay with you, Tayani, we might just get an example from you of that resource guide, and maybe we can share that out with folks as part of sort of the post webinar packet, if that's something.
Yeah, we would love to. We've done
with.
that with others actually. So yes.
Great. Okay.
Great.
So I've made a note of that. Great. Well, let's shift gears a little bit. So I'd love to ask your thoughts about operationalizing racial equity in this work of property management and serving and supporting residents. So, knowing that your organizations are committed to racial equity as sort of part of an aspect of your mission, important aspect of your missions, how does this commitment overlap with the functional property management in your day-to-day? And from your seat, kind of where do you see are the challenges? Where do you see are the opportunities to operationalize racial equity? And this is in the relationship with you as owners to your residents. It's in the relationship you as owners to your third-party managers. And then, of course, the relationship between your third-party managers with your residents, sort of all interwoven. So would love to just, hear from you practitioners, how are you thinking about this? How are you challenged by this? How are you seeing this as an opportunity in your work?
Well, I view that as kind of one of the toughest questions, and it's really, sort of really a challenge. During this era, we're taking special care to think about racial equity, think about systemic racism. How can we change our own behaviors and systems and practices to be sensitive and thoughtful on these topics? And I can't say that we have a pat answer. I do know that we talk constantly about seeking resident engagement. So I think seeking the voices of folks where we're providing services, we're providing dwellings, and getting their input and feedback in and of itself addresses equity, because the folks that perhaps are the folks that need the housing, that have the lower incomes, that have been disadvantaged, are being involved in, at least to some degree, in decisions that input how the properties are being operated. And so before COVID, we did have regular, at least multiple times yearly, town hall meetings, sort of events at our multifamily properties, still sort of figuring out, we hadn't quite figured out in a scattered single family rental portfolio over a broad, metro area, including suburbs as well as city, how to replicate that for our single family folks. But, I think those town hall meetings and getting input of folks that are being served, as well as being aware that even in the case of those of us that are owners and asset managers, as well as property managers that are African-American and people of color, there still are issues of class and inclusion that we have to consider. So for us, it's an evolving and ongoing exercise.
Thank you.
I agree with Tayani that it's challenging to do this. LA Family Housing as an organization has been working internally on our diversity, equity, and inclusion. And we actually have been doing this for quite a long time, so it's not completely without precedent. I am finding, and this is, you know, when you have to deal with an outside property management company, you're dealing with their corporate structure and how that corporate structure is set up. Our particular property management company, their actual corporate offices are located in San Francisco, so they're farther away from us. And so there are ongoing discussions about how to include them in to include the managers in trainings, how to make sure that our mission and approach is included in our property management companies' thought process when they deal with residents. We have a very robust meeting schedule with our property managers, as everyone else here, you know, on the panel is doing, to talk about all of this in an ongoing way. Nothing yet has been formalized, and I'm hoping. I have a small department and my bandwidth is very narrow, but I'm hoping that we're going to be able to do something that we can provide printed materials or invite and extend the invitation to our trainings to our property managers and the property management company. Los Angeles has a very large homeless population, which is impacted disproportionately for people of color. So there is a lot of conversation in the area about all this. My hope is that we continue to do this in an ongoing way, and it just isn't, you know, the next 6 months or whatever. So we're struggling like everyone else to kind of figure out how you put it out to an organization that really isn't they're not involved in the tent of your staff.
Right. Yeah. Thanks, Joanne.
I think we all felt that this was the most difficult question, and we really have to think about this because, as both panelists have said, it's a challenge because we're dealing with other management companies and their corporate structures. And I will say that our Diversity, Equity, and Inclusion Committee we do extensive talking about these topics, and we've had some very robust discussions about this. And Enterprise did send out, senior management sent out a letter to all of our residents, letting them know that we are committed to racial equity and eliminating systemic bias and racism in our communities, and that we're committed to that. And this is going to have to be something that's going to be ongoing, and the discussions are going to really have to continue. But I think we just have to exemplify what we're saying and make sure that that message is getting out to our communities.
And Carrie, I even think, just as another illustration of how hard it is, I can think of instances where in a town hall meeting pre-COVID or in conference calls or phone calls with a resident, I or someone on my team witnessed an offensive statement being made by someone either on our staff or working for a third-party management company, or a borderline statement, one of those implicit bias kinds of things. So it's sort of not a matter of a one-time training or we're going to do training once a year or twice a year. You have to think about how do you address, microaggressions and things that may seem insignificant and perhaps petty to talk about. How do you weigh when something rises to the level of importance that you feel that it is affecting the corporate culture, the nonprofit culture that the values that we all embody. We know that maybe some individual behaviors on occasion may not reflect that. How do we address that? So, help us. We all need to think collectively.
Yep. As we advertise, no one's got the silver bullet solutions, and these are all this is issues that these are issues that this panel is struggling with and their organizations are, and we figured that you are all as well. So thank you, panelists, for bringing such thought to that question and all the other questions. Let's do, we have about 15 minutes left, so let's get to some audience Q&A, and we're going to pull from both the Zoom Q&A and we may pull from the list of questions that that participants sent along with registration. So Jenny, do you have a first question queued up for us?
I do, and if there are other questions, keep them coming in the Q&A box. So the first question is, how are you tracking maintenance requests and that are on hold due to COVID-19?
Maintenance requests.
Our property management company already has a work order system. And so the work orders that haven't been done stay in the system until they're completed. We haven't completely, obviously if it's an emergency or if it's something that needs to be handled like leaks or a stopped up toilet, we have been doing the maintenance requests, mask on the faces, conversing with the owner, with the residents to know whether anybody's been ill in the unit, so the staff remains safe. The things that we have mostly put on hold have been the capital improvements. No more changing of cabinets, no more fixing of countertops, unfortunately. But anything that obviously is a habitability issue has to be addressed. But our property management company has been keeping, they have their list, they have their work order requests. Once we're able, things are a little bit more contained, we'll have them review the list and we'll start to go back into the units and address them, the needs of the residents, probably on a, based on first come. So if somebody requested it, the oldest requests first. We also I have an asset manager that works very directly with the property managers and the property management company. And so if there's a question, meaning if there's something that needs to be decided because it's on sort of on a borderline about what needs to be addressed in the unit, it'll get raised to her, and if she feels she can't answer it, she'll bring it to me and we'll have a conversation about it and make a decision. But we're tracking it through our regular work order system.
Great.
Great. I'm going to blend the next question. There's two questions that came in that are similar, so I'm going to blend these two questions together. Are there specifics on owner role communication with the manager? So for example, if there's examples of issue resolutions when approaches differ. So if the owner's approach and the management company's approach differ, how do you resolve that? And then one particular example that came up was we have 3 management companies that manage a portfolio. What do you do when you are more conservative than your management company and that you are not ready to start a phased approach to reopening your seniors population?
The last part of that question, to do a phased approach to what with the senior population, Jenny?
I'm sorry.
Can you repeat the last part?
Reopening. Yeah, when you
to reopening your seniors properties.
I see. So we actually are facing that with a third party property management company, or we're facing a similar situation that manages the majority of the portfolio they manage are their own corporate owned properties, and then they manage ours. They follow ANDP policy, our policy, and sometimes those policies are having to be established and discussed and created real time. So in terms of when we decided to close down common areas, when we decided to, you know, be more intensive with the cleaning, the food distributions, the outreach for services. Fortunately, our management company understands that they have to, you know, they bring decisions to us, and they don't apply automatically their policy for the rest of the portfolio on the ANDP properties, which are the smaller group. They may offer their policy as an example to allow us to make a decision, and then our senior management team will review that information and get back to them with a determination on how we like our properties to operate. On any number of policies, opening up is a good example, but it really has application in a lot of other ways as well.
Thanks, Tayani. Any others have anything they want to contribute to that issue resolution question?
Well, I'm fortunate in the fact that we only have one property management company through my entire portfolio, so we don't have to deal with disparate opinions necessarily. However, my opinion has always been is basically we're the owners, and the buildings that they're operating in belong to us, and we have liability for whatever happens in those properties. The property management company, despite what they may argue with you, works for you. And I'm fortunate to have a regional manager that understands that. And I also have access to his supervisor. So if there's an issue we can come to loggerheads about, we're able to get through it. They haven't been particularly, they followed what we've instructed them from the very beginning. You know, Los Angeles did a very early on safe, you know, lockdown basically. And so in the end, we got a lot of instruction from our municipal government about what they required us to do, wanted us to do, and how we had to set it up. And so therefore the property management company was required by our elected officials to do what was necessary. So there wasn't exactly very much argument about it. And again, because I have a asset manager who talks to the property managers on a regular basis, she's able to sort of work through any concerns they have. Plus, in some of our buildings, we also have program resident services staff, who are LAFH employees. And so they sometimes are able to elevate something they've seen or are concerned about, and we're able to talk about it. You know, if they see something they're concerned about, maybe the way the restrooms are being opened or not opened in, you know, public areas or whatever's ongoing, we're able to catch it fairly early on. But they shouldn't be allowed to, their contracts that they sign with you, they know who their bosses are, and they should be responding to your requests, not their upper tier management necessarily.
Joanne, I really agree with you on that wholeheartedly. I know that sometimes one of the things you said is really key, and that is you have an asset manager that is in regular communication with the property managers. And so we found that by increasing the frequency of our standing communications, and also then increasing the frequency of our in-between communications, sometimes they may make a decision by accident, sort of. You know, they're sort of following their protocol for the rest of the portfolio, and they don't make a conscious thought, oh, that's an ANDP property, I should have asked first. But if you have that organic, ongoing, more frequent communication, things come up, and you can, you know, insert and remind folks of those important issues.
Thank you both.
Thank you. Our next question is, how do you coordinate social service staff and property management staff to be on the same page with roles and responsibilities? And what are some practices you can share to provide best service to tenants? So I think this question is, how do you make sure that your social service staff and your property management staff is on the same page when serving residents?
I think that the question was, how do we coordinate with the resident services staff and the property management staff? Is that correct?
Correct.
You sort of broke up, Jenny. Okay. Yeah, and I think that's really key because with our community impact strategies department, they are continuously they're surveying the residents, they're doing the wellness checks, and they're checking in with property management on an almost daily basis to make sure that everyone is on the same page. And then the community impact strategies department, as well as property management, is also meeting with the asset managers on probably now, where it used to be monthly or bi-weekly, it's now weekly, if not in our senior communities or our high priority communities, almost daily meeting with these topics. So everyone has to meet. I think we've said it over and over, has to meet often, and there should be a protocol of the questions that need to be asked and what responses you're looking for, what information you're looking for, so that you can all be on the same page in the meeting to make sure everyone stays on the same page, I believe.
That's great. Thanks, Wanda.
Thank you.
Let's do one more, Jenny, and then we'll close it out.
Yeah. Well, I actually had two questions, but let me
go for it. No, I'm sorry. Go for it.
It's okay. So our next and last question is, in what ways is this pandemic changing the ways that asset managers and property managers interact? So I think it sort of goes back to what we've already iterated throughout this session, is communication is key, but in what ways have that changed between the asset managers and property managers?
Well, I can say for us, we like our property managers better now. We know them better, and we have more of a bond. We're sort of, unified in serving our residents in the best way we can, and there's a lot of kumbaya going on. Interestingly, that may not have to be assumed. I'm sure intense times can also create more challenging circumstances, but I've been really pleasantly surprised.
That is so true. I think that we are talking to our managers. We're talking with the property management teams. We're, going over things more frequently. We're bonding. We're really bonding because we have a common interest, and we want to protect our residents first and foremost, and make sure that our site teams and our residents are taken care of. And we really want to make sure our properties are being taken care of, but we are talking and having in-depth conversations constantly. So it is definitely a brand new bonding routine.
Well, we had always had very robust communication, meeting fairly frequently, talking to each other all the time, where it's a fairly small portfolio with lots of challenges in it. But I think that maybe what has happened is that there, as both Tayani and Wanda said, is sort of a newfound respect for one another. We're all in this together, and we're all working towards the same goal to try to keep the residents safe as best we can, and to keep our staff safe, and for the health and safety of our portfolio and for the ongoing success of our portfolio. So it's created interesting conversations. We've gotten to know more about the family life somewhat of our property managers, and for those that are actually living on site, how this has impacted them when their residents are sick. So I think it's made us stronger and better together. Also tireder. So
yeah, that's right.
Well, I love that we're ending on a positive note there. So I want to thank Wanda and Tayani and Joanne for such thoughtful contributions to the discussion and for the prep that I know you put into the discussion to make sure it was really substantive. So appreciate you three in particular, as well as Jenny for managing the Q&A and my other enterprise colleagues. So stay tuned for our follow-up takeaways. Please participate in the survey that is going to come out to you tomorrow to just tell us how we can improve. And have a great rest of your week. Be safe in body, mind, and spirit. And thanks for joining.